is for a patient that is being ventilated via an endotracheal tube, but that does not have an inline suction that's installed on the tubing of the ventilator. So just as a recap, so we've talked about a patient with a tracheostomy that is non-ventilated. So we do an open type suction. We have patients that are ventilated via tracheostomy with an inline, that we would be able to use an inline suction on these patients, or disconnect them from the ventilator and do an open suction. Now we also talked about a patient that has an endotracheal tube that's ventilated and that has an inline suction, such as this one. And now we have a patient with an endotracheal tube, but that does not have an inline suction connected to the ventilator. So in the event that you have a patient that doesn't have an inline that's set up and that you need to suction them, that there's a clinical indication to do that, you would do it the same way that you would a tracheostomy with an open suction. So you would proper hand hygiene, you would explain the procedure to your patient, and you would wear the proper protective equipment. So I would have gloves on, I would have a mask, I would have a face shield, or goggles, depending on what you use, and depending on what type of precaution they're on. This would be an aerosolizing procedure, so you want to ensure you have the proper equipment. If it's a COVID patient, then you would put N95 in a visor for sure. So in this case, very similar to the other patient, so I'm going to go quickly through it. So the tracheostomy patient with an open suction. The idea again is to prepare everything you need before you disconnect the patient from the ventilator, assuming that he can tolerate it. If these patients don't tolerate it, you would not do it, but the first time, then you'll have to actually see if they can tolerate it. So you would have your suction kit that you would open and that you would prepare. It's the same idea where you would have to put your gloves on. So now you would, with your non-dominant hand, in my case is the right hand is my non-dominant, I'll put my normal saline or my sterile water. I'd be able to grab my catheter with my dominant hand that will remain sterile, and I'll be able to touch anything else with my other hand. So in this case, we would be almost ready. So I could connect this to the suction. Again, the suction 80 to 120 millimeters of mercury. I would pre-oxygenate my patient with 100% bolus. Once that's been delivered, I could disconnect. The other option is to give the bolus of oxygen with the ambu bag, but it's always easiest to do it directly through the ventilator. So once I'm at the point where I'm ready, I would disconnect my patient from the ventilator. I would get my catheter ready, and I would have to fish my catheter through the endotracheal tube, likely quite deep, just because of the distance. So you want to make sure, unlike what I just did, you want to make sure that this hand does not touch anything that's dirty. It has to remain sterile. So once I'm at the end, then I would go and suction. Again, just a seamless, not too fast, not too quick motion. And then this stays sterile. I can go and rinse out my catheter. If I need to return again, then I can go again inside, fish it through. And obviously I would have hyperoxygenated before doing this. And then again, I suction out. So once you enter your catheter, it's the usual, you feel resistance, you pull 1 or 2 centimeters out, and then you start suctioning. So once we think that we're all good, we quickly try to reconnect our patient to the ventilator. And then we can get rid of our suction catheter as required. You could also, again, use it, just clean it out and use it to go and suction just above the cuff like we did in the tracheostomy video. To clear any secretions that accumulate in the back of the throat and above the cuff. That would be your last step before throwing everything out. And then you would do your post-suction assessment to ensure that your patient is respiratory status is okay and that they're stable overall.